Opening up space for the lateral incisor implant. This is one of the most common and very challenging situations for orthodontists across the world. Let's see how we can get this job done and separate the roots adequately for implants in one set of aligners. The components of a successful outcome for this movement include understanding cuspid tipping reaction forces and what it means to the lateral incisor beside it, or the central incisor in this case. Understanding the advantage of using small pontics. Understanding the biomechanical principles in aligner biomechanics with offset horizontal attachments, and also Willie's 4-arrow system. And finally, understanding tipping over corrections in aligners. With your subscription, you'll be able to open up each one of these videos and have further learning into this topic. So let's look at this case. This gentleman, who's about 30 years old, has Maryland bridges, but you can see that the roots are not separated adequately for implants. The crowns don't need to move. The crowns are already in the right place. So it's really only root movement that's required. But root movement is one of the hardest movements to do, since tipping teeth is easy, but tipping roots is not easy. We're going to be using the 4-arrow system, and you can see a picture of it here. We're going to be using small pontics that do not fill the space. We're going to be using horizontal attachments on the buccal as well as lingual attachments, vertical lingual attachments on the lingual surface. In 28 aligners, this patient now has parallel roots and can get their implant. We want you to work smarter, not harder. So in 1 year's time, this patient now has room to place his implants and have a smile with parallel teeth and without a Maryland bridge the rest of his life. In this second case, there are many more orthodontic challenges for this patient. She has a functional shift, CRCO shift, to her right. Her mandible is asymmetric to her right. She has class 3 tendencies, and she's missing the upper right lateral and needs room for an implant crown. Now we're going to be using many of the principles that we used last time, and you can see in the proposed plan, those principles are not there in the first proposal plan from the software. We're going to modify the plan and put in our offset horizontal attachments, our lingual vertical attachments. The pontic is going to not be there, then it's going to appear but be smaller, then later a little bit bigger, but never filling the space, and always very, very thin buccolingually. After the first set of aligners, the crossbite is corrected. We are now detailing the case. The implant is placed, and during the second set of detailing aligners, it's really almost passive aligners as the patient's implant is integrated and we're waiting to get the implant crown. So you can see that during the treatment the patient is wearing elastics, maybe even crossbite elastics, along with lingual and buccal attachments on the very important teeth to create the room for the implant. When it's finished, the roots are separated, the implant is placed, the crown is then placed. At the end of treatment, the patient still has asymmetry, but if we take a close look, we can see her smile is symmetrical in the maxilla, and the camouflage of her asymmetry is built into the mandibular dentition. Again, many more details go into making one orthodontic case. I invite you to dive deeper into the components of a successful outcome for opening up space for a lateral incisor implant, and also in many of the other videos and topics covered inside your subscription. Further, if you have colleagues that are not working smarter and they're working very hard to get these things done, we'd invite you to refer them to yourorthocoach.com.